I think certainly for all of us and for patients, I really do think that this is, a new powerful tool in the armamentarium. So trastuzumab deruxtecan essentially is an antibody drug conjugate. It's trastuzumab, conjugated with a linker to a strong cytotoxic molecule. And it's been, as you said, FDA approved in breast cancer for a little bit, and just received FDA approval last week. So the FDA approval is interesting in the sense that it was based on a well-conducted randomized phase 2 study that was mostly, I think it was either exclusively or mostly Japanese patients, but certainly an East Asian study without US or Western European patients. But it was a randomized phase 2 study in the third line setting of trastuzumab deruxtecan versus dealer's choice of therapy. And certainly it beat chemotherapy in every respect. Again, high response rates in excess of 40%. And with superior PFS and with superior overall survival compared to chemotherapy. So these data was submitted to the US FDA, and it's now been approved for any patient who's had progression on trastuzumab-based therapy. We've also participated in a single arm phase 2 study in a Western population, so US and Western Europe. And I'm hopeful that when those results are eventually presented, that we'll also see that there's comparable activity in the second line setting as there is in the third line setting. But I think that for patients who progress on trastuzumab, it is absolutely a new therapeutic option. I would caution that at the end of the day, there is a chemotherapy moiety attached to the trastuzumab, so we have to be aware not only of chemotherapy-like toxicities, but there actually is also a toxicity that any prescriber needs to be aware of, and that's interstitial lung disease. And in about 9% of patients, for reasons that actually don't remain fully understood, there is a risk of interstitial lung disease or pneumonitis. So one absolutely has to be on the lookout for it, both symptomatically, but also even in terms of asymptomatic changes on CT imaging. And for now, there are extremely kind of very careful conservative guidelines as to when to hold the drug, when to start steroids, or when to even permanently stop it. But trastuzumab deruxtecan, in addition to ZW25, in addition to a couple of other drugs, really I think heralds for the first time in a decade a new class of anti-HER2 therapy, which really has the potential to improve outcomes significantly for the 20-25% of esophageal gastric cancer patients who have HER2 positive tumors.